autopsies on 20 of those cases. Of those cases, 226 cases were submitted for histology. And of those 653 cases that were brought in for evaluation, cause and death of 400 of those cases was, the average turnaround time was 15 days. The other remaining cases took 32.3 days to finalize cause and manner of death. And for our cremation permits, we received 2,938 requests for cremation. And of those, of course, as you can see, it took 0.24 days. So it was averaged during the work period.
Okay. Under decedents, when you say 653 of the decedents were accepted,
Mhm.
what does that mean? That
So
means
it's-
there's
Yep, so accepted means,
300 that weren't.
yep, so accepted means that our office, the doctor decided that those decedents needed to come into our office for either an autopsy, an inspection, or a limited autopsy.
And the reason they would not come?
It could have been a hospice case. It could have been a case of a person that died at home, but they were under care of a physician and didn't necessarily need to be brought in.
For purposes of autopsies or further
Correct.
testing or?
Correct.
Okay. And I'll just note again, we got a lot of outstanding invoices on cremation permits.
You said you have some?
No, we do have them. Outstanding invoices.
So if we do have any outstanding invoices, it's because they either didn't pay
Yeah, I
and
know.
are waiting to get the
No, I'm
payment.
just noting that for the
Oh,
record
yeah,
because
okay.
that was such a, there was a lot of conversation around that a few years ago.
Yep.
And now that we have the permits down to 15 minutes or whatnot.
Yep.
Okay, we got them to you.
Yeah.
Okay, we got them to you. Questions from committee members on this report? Commissioner Marecki?
Thank you. So are there any repercussions for that?
Once they permit payment to us, then we automatically turn it back on. They're able to receive their cremation permits.
Okay, so they do pay for,
They
okay,
pay. Yeah, they pay. Yep.
All right, thank you.
But they don't get the permit till.
To the
cash in
balance is
hand.
paid in full. Yep.
Okay. Members of the committee, questions on this report? Commissioner Anderson.
Thank you. Thank you. Charlie, you did say that did you break down the unidentified?
Nope. So you all will have an annual report soon. So I'll see you all, I believe, next month, and then we'll go over that annual report. Yeah.
Okay, very good. Thank you.
Commissioner Baker McCormick?
And just to clarify, in that report, I think I mentioned before the opioid cases, and I would like to see them,
Broken down by demographic.
exactly.
Yep. So in the annual report that it will have the opioid cases, but
Okay.
it being broke down to demographic, that's going to take a little further time. And I'm
Yeah.
working with public health and the
Okay.
epidemiologist to get that information to
Yeah,
you.
because we know that there's a serious issue with fentanyl in Detroit.
Yeah.
And unfortunately, a lot of people are passing away, and I'm just trying to figure out what that looks like.
Yep. And then
I don't know.
pinpoint where it is.
Yeah, thank
Yeah.
you.
Mhm. You're welcome.
Yeah. Commissioner, I'm gonna get the hyphen right. Peterson Mayberry.
You'll be the first one.
I'm like, Mayberry, Peter.
Through the chair, I just want, not a question, just more of a comment. I know I started doing some research, and so I just want to commend the department because I know under the National Association of Medical Examiners, industry best is 90 days or less. And so we're well within that. So I was trying to see where we fail in terms of turnaround time. So I just wanted to commend. My question, I guess I do have one, is for those, you mentioned for those that don't come through the office, it's because maybe physician, hospice. Are there any that we turn away because of staffing or manpower?
No.
Okay, no, thank you.
Commissioner Baker McCormick.
Just a follow-up, the suicide rates.
Yep, that's gonna also be
That's
an
all-
annual.
Okay.
Yes,
And
ma'am.
by demographic?
Yep.
Okay, great. Thank you.
So next month is your annual
Yes.
report.
Yes, and I'll be bringing Wayne State with me.
Well,
Chief
that
Medical
was going to be
Examiner.
my question,
Yeah.
right? Because
Yes.
they've been managing for like 3 years now.
Correct.
And of course, they've discussed when we approved them that
Mhm.
they would, for public health, that they would be tracking
Mhm.
these things. So we can have that discussion
Yep.
with them next month.
Yes.
Fantastic. Questions, commissioners? What's your pleasure for disposing of this item? Was that a motion?
Yes. I move to receive it.
Yeah, that's your pleasure. Is there support? Yeah, Baker McCormick. All right, all in favor of receiving and filing this report, please vote, say aye, whatever it is. Now I got to,
Motion carried.
Yeah.
Thank you all.
I'll do that. Oh, here. Yeah, okay. Next item, Madam Clerk.
Item 2, forwarding a report on the activities of the naloxone vending machine initiative/contract.
Well, welcome to the table. Name and titles for the record.
Hi, thank you. Good afternoon. Dr. Avni Sheth, Chief Medical Officer and Clinical Care Services Division Director for Wayne County HHVS. And I'm joined by Tara Kink, who leads our community behavioral health work, and I'll let her introduce herself.
Hi, Commissioners. Good afternoon, Tara.
Is the mic on? Yeah.
There we go.
When you see a green light, you're
Here we
on.
go.
Yeah.
Nice meeting you all. I'm Tara King, Community Behavioral Health Administrator under the Department of Health, Human and Veteran Services.
And we're excited to present to you a report that provides cumulative report up to date on the Wayne Station initiatives. This is about almost a year since we launched this effort, and we are really excited about the progress we've made in expanding access to these life-saving supplies throughout Wayne County. We've reached about over 70% of municipalities covered with an access point, with over 60 Wayne stations placed throughout the community, really increasing awareness for these supplies and hopefully decreasing the stigma around this. So we put this out in the community where it's needed. I'm going to hand it off to Tara King, who's going to provide a little more details through the report. And we're excited to take any questions.
Thank you, Dr. Sheth. Just as kind of a high-level overview of activities that have taken place over the last year, as Dr. Sheth stated, we are really in the first year of implementation. Placement efforts, when we're talking about placement of vending machines or newsstand-style devices, occurred late August of 2024. And so this is really the first year of activities. I would be remiss if I didn't recognize the collaborative efforts that have taken place between some of the individuals in this room from special projects under HHVS, as well as our collaborative partner from Center for Behavioral Health and Justice at Wayne State University School of Social Work. So I think one of the biggest things to acknowledge is the true collaboration that exists not only across governmental entities, but also those from multi-sector partners in making this initiative not only exist in the community, but really being implemented with some success. As far as high-level highlights over the last year or so, just a quick update from data that you have in the report. The report runs through the beginning of July 4th. Since it is August right now, data from September 1 through August 8th, 2025, we actually have 70 stations placed in Wayne County. Just a quick breakdown, that's 42 newsstands and 28 vending machines. In addition to that, I think understanding the actual distribution of supplies is important. In the last 11 months, we've had over 15,000 naloxone kits distributed. We've had over 5,000 fentanyl test strips distributed and over 3,000 xylazine test strips distributed through those 70 locations. So I think that's important to acknowledge in terms of the uptake and utilization utilization of those devices. The other piece to really acknowledge is understanding disproportionate impacts in our communities. Of the 70 stations we have, 55 of those are placed in high overdose zip codes or zip code tabulation areas. That's roughly 80% of all placements occurring, and that's based on overdose rate, a 5-year overdose rate from 2018 to 2022. So just acknowledging not only placement efforts, the collaboration, but also our supportive partners that exist across multiple entities and making this initiative live. The other piece to really acknowledge are some of the ancillary activities that help support this initiative. In the quarterly report, you had some items, including the End Overdose Wayne campaign, which is an anti-stigma and public awareness campaign. That includes not only the launch of endoverdosewayne.org, which is our public-facing website, but a number of assets, including social media campaign, gas station TV videos. We just launched billboards in the last week. Some of you may have seen them. They're digital billboards. There's roughly 20 throughout the county. We also have a community toolkit that has a number of printables, including fact sheets and posters, and translations into Bengali, Arabic, and Spanish, not only for website content, but also those materials.
You cited some numbers on 15,000 distributed, 8,000. Is that a different number than the number that citizens have taken out of the machines so that they have them?
No, so that number just represents supplies taken from the machines. So one of the huge strengths in our operational partner at CBHJ is really doing a lot of the tracking of data related to this. So every machine.
BHA?
CBHJ, that's the Center for Behavioral Health and Justice at the
Alright.
Wayne State University School of Social
Helpful.
Work. Yes. So they're doing tracking as far as supplies taken from machines. And that number, that figure of naloxone kits taken, represents all kits taken from the machines, those 70 stations that are placed throughout the county.
And how many have been taken?
15,000.
And we're funding this with the opioid settlement dollars, correct?
Yes, it's a braided funding structure that includes both opioid settlement funds and general funds, and runs as a 4-year contract.
So is the funding there to replace these items in the machines?
No.
And do what you need to do to run the program? The funding exists for that?
Yes, so the funding not only supports all of the operations associated with the initiative, and it's a 4-year initiative running through the end of 2027, December 31st, 2027, but all of the material, supplies, staffing that exists associated with it. For awareness, and it's represented in the report as well, but all of the naloxone kits that are currently used, so our sole supplier for naloxone is actually the state of Michigan through the MDHHS naloxone portal, and that's a public resource. I'm stating it now because I want to raise awareness about it because it's accessible to anyone, any entity that's also interested, but that is where all of the naloxone is supplied from.
I just have 2 more questions and we'll turn it over to the other committee members here. In the data, is there any way to see if this is having an impact on the number of overdoses in Wayne County? Is there any way to tease that out of the data?
I'm going to add a couple things and then I'll toss it over to Dr. Sheth. So I think one of the most important things to understand is the complexity of the issue that we're talking about when we're talking about overdose deaths. So it is not a single solution or a single initiative that necessarily solves the problem. And I think a lot of the work that is taking place, not only under this department, but in collaboration with other governmental partners, including the City of Detroit and other community partners, to really have strategic alignment around how some of these initiatives are being approached can help address the issue. I think the other piece to understand is that this is one of multiple initiatives that exist in Wayne County for placement, community placement of vending machines and newsstand devices.
Well, given all that, is there a change in trajectory of the number of overdoses in the county? Because yeah, there's a lot of activity going on besides ours.
Right.
Are we able to figure that out?
So just to add to what Tara described, we are looking at general trends over time with our overdose data and our overdose rates and seeing the disparities. Commissioner Baker McCormick raised an important issue about our racial disparities with our overdose fatality rates and then our geographic variation. So we're looking at that data right now and producing a report in the coming months that really looks at trends over time for around the last 5 years and where we're at right now. So we hope that we're moving forward going to be tracking it and monitoring this data over time and hopefully seeing an impact of these various multi-layered initiatives, right? So naloxone is one piece. It's saving the life, but we know that there's so much more that we have to layer on top of this issue to really have a comprehensive effort around overdose response. And so with treatment, expanded recovery options, making treatment accessible, for example. And so we are layering on this comprehensive strategy alongside our partners in this space in Wayne County to really make an impact because we know it's going to be not just one thing. The drug supply continues to become more and more dangerous. Commissioner Baker McCormick raised fentanyl. That's driving 4 out of 5 of our deaths. There's newer and newer drugs emerging every year. So this is, and it's not an understated thing to say, this is one of our longest public health crises that we've dealt with in this country. And so we hope that with this data that we're collecting, that we're continually, evolving our strategies and working alongside partners to tackle this.
And a report will come to us when you have, okay.
Yes.
The last thing I have is you had a section called Next Steps to analyze the findings from the Community Pulse Survey, which was run June, July of this year. What is that survey? What is that aimed at?
So that was a smaller survey that was conducted. It was public facing, but it was developed in collaboration with our team and the Center for Behavioral Health and Justice. And it went out to partners really assessing awareness of naloxone, awareness of naloxone access points, perception of naloxone, as well as community needs around additional supplies. So one of the pieces that was identified in there was a list of a number of supplies beyond just naloxone, fentanyl test strips, and xylazine test strips to try and solicit input at both the provider and the community level regarding community needs related to supplies. But that is a smaller survey that was conducted as part of our operational activities.
Okay, so that's going to be nonprofits around the county that deal with SUD or whatever, that you surveyed them to see what the bigger picture is.
It was public facing, so anyone in the community, anyone that is an employee or volunteer in all of Wayne County, was really targeted towards those respondents. And so I think current analysis is underway and we can provide an update as needed in the future.
Thank you. Commissioners, Commissioner Marecki.
Thank you, Mr. Chair. So in our information, it noted that there was 930 overdose fatalities in 2023. And we weren't doing much with the fentanyl stuff back in 23, right? I mean, this has been really started in 24.
This effort launched around September 2024. But, for years, there have been a lot of organizations working in this space and other providers in the harm reduction space, specifically distributing naloxone to the individuals they serve through their work. So, there are other points of access and efforts around decreasing overdose rates and improving substance use outcomes. But this initiative, yes, launched last September.
Okay, and I understand what you're saying, analyzing the multi-layer, but in this year, have we seen a drop, like numbers, straight across numbers of fatalities?
Yeah, so with fatality data, it's challenging to analyze. It gets finalized over time. So right now, what we're looking at is fatality data through 2023. We hope that we have access to the through 2024 data. And then we are exploring other data systems where we can get a little bit more real time, I shouldn't say real time, but more recent death data. There's always a lag with finalizing the death records, the cause of death, all of those things, and accessing that data. So we don't actually even have the vital records for 2024 yet. The state usually is finalizing that in the fall of the following year. So that just gives you a sense of the lag there. But, we are really expanding our efforts around data in this space, mainly because we are really expanding our efforts in this space, and we need the data to drive a lot of these efforts. So we're hoping to get a little bit more recent data, to your point, 2024 early quarter data, just to see the trend. We know that across the state and nationally, there have been some hopeful improvements in overdose fatality data, but we have to look at our own data to be able to understand our impact.
That makes sense.
Mhm.
I mean, it just would be nice at one point if we just get
Mhm.
numbers. And I know it's
Yes.
very complicated,
Yeah.
but just to see numbers. All right, thank you.
Thank you, Commissioner. Commissioners, I got Commissioner Baker McCormick and then Commissioner Peterson Mayberry.
Thank you, Mr. Chair. To Commissioner Marecki's point about data, I know it's difficult, and that's kind of why I was asking the coroner's office to kind of
Mhm.
get, because you guys have to work together on that type of data. And so with that, I know you're working on it, and I'm glad that you're working on it. I appreciate all the work that you guys are doing. I did see the billboard sign, so that was good to see in the community. So I want to say I appreciate that as well. Medication versus street drugs. Do we have, and can we get at some point maybe numbers on what was the death related to? Was it medication from a doctor, or was it street drugs? And I don't know if that's something you're looking into as well. Just wanted to.
So I can just provide some general comments around that.
Okay.
We know that the trends in what was impacting overdoses has changed tremendously over time. And so what we're seeing at the national level, which is very similar to what we're seeing here, is that prescription driven, so actually a medical provider prescribing an opioid of some sort, driving overdose deaths, that has declined significantly. And so what we're seeing right now is the vast majority of deaths are due to, 4 out of 5 deaths are due to fentanyl, which has contaminated the kind of counterfeit pill and drug supply. So what people are oftentimes using are things that look like pills, but they're not necessarily prescribed by a doctor. And so what is driving the vast majority of our deaths right now is the kind of the illicit drug supply, the counterfeit pills, the powders, things like that, where fentanyl has contaminated that supply.
Okay. And you said you're working with Wayne State School of Social Work, which I'm glad to hear that, because the Youth Council was very instrumental in working with them, and they actually brought them to the table on some of these issues. So it's good to hear you're working with them. Are they looking at treatment as well? Are they driving any treatment? I'm not sure exactly what their exact role is, so I wanted to get that clarified.
Yeah, so they're the contracted partner through an intergovernmental agreement for this initiative. And so we work hip to hip with a small team that's under the Center for Behavioral Health and Justice, not only in planning and strategic development, but also the actual operation and implementation of this. And so if you think through not only 70 devices that are live right now, but all of the inner workings that go along with placement of those devices, stocking of those devices, tracking, engagement at the community level to support host site recruitment. So going out into the community, doing outreach, building those relationships, and really helping support long-term implementation.
Okay. I think that was it for me. Thank you. Thank you.
Thank you, Commissioner. Commissioner Peterson, Mayberry?
Thank you. So actually to piggyback, are we partnering with schools? Not colleges, I mean like high schools.
In terms of placement of
Yes.
potential devices, that would be great. I say that to say we've had some conversations through year one to try and support outreach, engagement, and collaboration. And I think if there are any recommendations, any connections that any of the commissioners here have, just in terms of potential host sites or placement efforts, please feel free to send them our way, because I think that's been a goal, but it just has not yet come to light. One of our placements is at a performing arts center that also has youth performing arts.
I saw that those locations. Unfortunately, those are some of our audiences that we need to make sure that this is in. I do want to commend. I not only saw the billboard, but I received a Narcan being at an event, and they were giving them out to individuals. What is a newsstand? So I think I'm pretty comfortable about what a vending machine is, but 38 of these were newsstands. What visually should we expect when we are talking about a newsstand? I know what I would perceive one to be, but what is one in this case?
Probably very similar to what you're
Oh,
envisioning. So
okay.
just a retrofitted newsstand. It's a metal device. It's branded in the same way that we have the Wellwayne stations kind of wrapping on it, and the same sticker that's on top that helps support identification and response to an overdose, but really just very similar.
It's like
to
a newsstand.
Yep.
Okay.
Yep.
The last question, does Narcan apply, and I know the doctors start mentioning this, does it apply to all drug overdoses? And I'm only mentioning this because we know that there not only is an increase in like meth, but also this new gas station heroin that our young people are getting their hands on, as well as nicotine nicotine pouches that our young people are also getting their hands on. So does this Narcan address all overdoses?
Yeah, so that's a really good question. So naloxone specifically is the antidote for an opioid-involved overdose. So it really only will reverse the effects of an opioid overdose. What we do see is that there's lots of individuals who don't really think that they're taking an opioid, but in fact, there is something like fentanyl or some of these other really strong opioids within that substance that they are using. And so what we find is that, fentanyl, for example, which is a very strong opioid that naloxone does reverse, is in things like cocaine, is in things like methamphetamine. It's been found in the larger drug supply. So individuals who may not even think that they are using an opioid are at risk for an overdose. And in fact, those individuals are more at risk because they don't already have a tolerance to opioids. So they could just be using once, not even what we think of in our image of an individual who uses every day. And so that's why what we always stress when we do the education around naloxone is that even if you don't know what the drug may be, if you suspect there's an overdose, just use the naloxone, which is a very simple nasal spray. I'm sure you've all seen it. If it is not, in fact, an opioid that is causing the overdose, nothing will happen. Unfortunately, the person will not be revived. There's something else happening. It could have been a heart attack. It could have been something else, right? But it does not do any harm to give it a try, because oftentimes that is what's driving the overdose.
Commissioner? All righty. Commissioner, questions? I'm glad somebody's found a use for old newsstands. Those are like gone. I used to do it up at Michigan and Griswold here, outside of the drugstore there, Kinsel's. Used to be all over the place. Now there's no newsstands. Commissioner Anderson.
I did have one, but it was one of the questions that you brought up. So I wondered about the ability to keep the vending machines, or if you want to call them that, keep them stocked, how difficult that is. Are you finding it a problem whether or not there's people that are going in and taking a big handful of them? Or is that causing any problems?
Yeah, that's an interesting question. I think one of the pieces when the question was asked before, what does CBHJ do, right? One of their core responsibilities as well is coordinating and helping support stocking of those machines. So pretty rapid monitoring and checking for restocking of all. That's a big piece of this. One of the key pieces for the initiative was to try and make this as low barrier as possible for any entities that were partnering with us to host these devices. And so to make it as easy as hosting a device and then having all of the supplies stocked independently and free of charge is a part of this. The other piece, I know it's been brought up before in this space, is consideration for like vast quantities of supplies being taken. I think understanding if that occurs, it is because there is a need, right? That supplies are being taken, that clearly there is a market in some way and a need to take supplies. These are overdose reversal medications and drug checking supplies. And so it's one of the pieces that regardless of how it gets out into the community, great that it's through these devices, but as long as there are supplies in the community, it helps address the public health risk.
I know there's people that'll try to take advantage of things, no matter how well-intentioned they are, being placed there for the benefit of people that might overdose. People will, I've seen and read of people taking things and turning around and trying to sell them to other people, thinking they had to pay for those items when they could actually get them for free to have on hand. If they know someone in the neighborhood or a neighbor or a child or a nephew, niece, that just want to have something on hand, that's, I think, legitimate. But what was concerned about is that some unscrupulous people would go in there and just take a handful of them and then try to sell them to see if they could make some money on them. So hopefully that doesn't become a big problem. But like you said, with the restocking, continuous restocking at no cost to the county is, I guess, helps offset that. Thank you.
Thank you, Commissioner. Questions from commissioners? How about a motion then? Oh, that's for receive and file. Is there support?
Support.
That's been supported by Commissioner Marecki. All in favor of the motion?
Aye.
Vasily, say aye.
Please vote using your tablets.
Or vote on your tablet.
Motion carried.
Thank you. Madam Clerk, next item.
Item 3, forwarding a report on launched Wellwayne projects, including activities of the RIP Medical Debt Initiative.
Lady. And sort of in a similar vein here. Well, Wayne, how we doing?
Good, good. Good afternoon.
Name and title for record, please.
Good afternoon, everyone. My name is Keneal Johnson. I'm the Interim Director of the Department of Health, Human and Veteran Services.
Aja Harris Martin, Chief Programs Officer for HHVS.
So today we'd like to provide you a report that provides an update on programs previously approved by Commission and launched as community health initiatives to serve Wayne County residents. And additionally, with the report, this is our first report to you all, and we have provided some additional information. We've also included our Wayne program pipeline, which outlines the status of other proposed projects and programs. Do want to take a moment before we get into the report just to thank the commissioners for supporting all of our Wayne programs, as well as our partners that we collaborated with to launch the programs. Additionally, our Chief Programs Officer, Aja Harris, and her team that did a lot of heavy lifting to make these programs possible in the community. So as the report will include updates on the Wayne Air Quality Network. And just to provide an overview of what that program is, this was a program that was launched in partnership with Just Air. The initiative was known as the Wayne County Air Quality Network, and the aim was to enhance environmental health monitoring and public health engagement through the deployment of real-time air quality sensors in targeted communities throughout Wayne County. And so what the report will show you is that this program, under this program, we did deploy 100 air quality monitors throughout Wayne County in, I believe it's 55 zip codes, with over half of daily AQI readings in the good range. AQI is the average quality index. We have also deployed this year 10 mobile monitors. That was, a new initiative that was launched this year, and that was targeted to initially to children to be able to, any child that uses a rescue inhaler, they could track the air quality monitor around them at that time. So that's a new initiative that we launched this year, and we have 10 of those deployed. The number of dashboard subscribers, as you'll see in the report, is 241, and this is as of July 1st, 2025. The other update is around the Wayne Medical Debt Relief. This was formerly known as the RIP Medical Debt Initiative. That organization is now renamed under Undo Medical. This project focuses on reducing the burden of medical debt for low-income Wayne County residents by purchasing and forgiving eligible debts. You'll see in the report the medical debt relief. The program has eliminated approximately $42 million in medical debt for over 71,000 Wayne County residents. This effort is part of a larger national initiative that has relieved $30 billion in debt for 20 million people. And we are going to be, over the next couple of months, we are going to be pursuing a no-cost extension and asking for commissioner support in connecting with local health systems to expand our reach. This contract is expected to end December of this year, but we will need an extension to be able to allow for more time to spend the funds under this contract. The Dr. Sheth and Tara King provided the update on the Wayne stations. The other program that is on the report is our Vision program that was done in partnership with Vision to Learn. Since the launch of the Vision to Learn program, which was done in October 2024, we have completed screenings, eye exams, and glass distributions at 40 sites, including 39 Wayne County schools in Redford, Ecorse, River Rouge, Harper Woods, Melvindale, Taylor, as well as residents of the juvenile detention facility. This program goes through June 2027.
Okay, thank you.
Mhm.
So on the medical debt, we allocated 5 million for that,
We did,
and you've spent $500,000 roughly,
correct.
and that's generated 42 million of debt paid. But there's a lot of other players in this arena. I believe the state of Michigan is doing this also.
Yes.
So going forward, do we continue what we're doing? Do we join with the state of Michigan? Well, going forward, we are going to have to re-up it, right? Because the deadline is,
Yes, the deadline is, it is December 31st of
Yeah.
this year. So we are going to ask for an extension, which will allow us more time to buy additional debt.
right?
But we are going to continue with the original terms of our contract, and it will not conflict with what the state of Michigan is doing.
Yeah, so if the state has if you think of it as like a Venn diagram, there are certain eligibility requirements that each contractor, us being one of the contractors with Undo, the state being another one, they may have different eligibility requirements. Our eligibility requirements are different from the state. They will try to use the state's money first, and then in our agreement with Undo. And then if a person is eligible under the state, they'll use that. If they're not, they'll use ours if they're still within our eligibility requirements.
So they don't necessarily have the same.
No, they're not exactly the same.
Everybody hated Venn diagrams when I was doing math in high school. Now they're all over the place. Facebook has Venn diagrams every day. Okay, so that's good. So that provides a wider coverage. Okay, commissioners, questions on this report? Commissioner Marecki and then Commissioner Wilson.
Thank you. Just clarification. Right, okay. Yeah, right, thank you.
Commissioner Wilson?
Thank you, Chair Colleen. Just a quick inquiry. invariably, there are individuals who can't pay their medical debt. And I got a whole bunch of them in my community.
Mhm.
So how do I get selected? I mean, obviously we have eligibility requirements. Am I sitting in a hospital with a $500,000 debt and somebody tap me on the shoulder and say, look here, I'm going to eliminate this debt because you fall under the program, versus the person who's down the hallway who has $1 million worth of debt and doesn't know anything about this process. So what I guess what I'm getting at is that a lot of folks I talk to don't have any idea of this medical relief program.
Yeah.
And how do you get engaged if you don't know anything about it? And I'm just speaking from people in my community because I've talked to a few individuals. Don't need to mention any names, but I can't seem to get a clear answer
Yeah,
on how
so-
people are tapped on the shoulder to get an opportunity to have their debt released.
So this is not an opt-in program.
Okay.
So residents do not have to reach out to opt in. What it is we purchase the debt from the healthcare providers, and we being through Undo. They go through an extensive negotiating process. They also go through an extensive data collection and analyzing and auditing process to ensure that they eliminate the debt. A lot of this partnership with Undo is heavy on the relationships. We are currently in partnership with one of the major hospitals. We're also kind of consolidating a lot of the hospitals in our Wayne County area, which have provided some challenges for Undo to negotiate because, no one wants to do anything while they're going through a joint venture. And so that created a lag. The other thing is that it's also hard to get in contact with some of our healthcare organizations. So individuals cannot reach out to Undo to get their debt eliminated. It is really a partnership between Undo and the hospitals. So we definitely call out, similar to the Ask Last, if you all have constituents and or friends, colleagues, peers, husbands, wives, et cetera, who sit on boards or have influence at various healthcare organizations, we would love a connection with them because that's really what starts the process of the medical debt relief to the individual. So far, a lot of the debt that we've received is from third-party creditors. So hospitals sell your debt to a crediting agency, kind of pennies on a dollar, and then we buy that debt from the crediting agency for pennies on a dollar. It hasn't been from directly from healthcare institutions as of yet, but we are in the hopes that it will.
Wow. Okay, I'm somewhat confounded. Obviously,
Yeah.
I mean, how do you,
You don't,
go ahead, Terry, I'm sorry. Thank you. I'm still
so you
confused.
don't reach out, yeah.
Yeah, I'm still
You
confused.
get a letter, right? See, that's been really.
Right.
Okay. I got a bad credit report. My debt is going through the roof with medical, and the guy next to me gets the nod and I don't because of the healthcare provider
Yes, where your debt lives, right? So we're trying to partner with the agency where your debt lives to then purchase that debt. The healthcare industry, as many know, is a very complex system. Coming from the healthcare system myself,
Yes,
you
ma'am.
can have one ER visit and have 4 bills coming out because you have the facility fee, you have a provider fee, you might have an emergency kind of room visit fee or kind of transportation fee, et cetera. And so what we are trying to do with Undo is expand that continuum of care, who they could potentially partner with. And so that's our ask for commissioners. If you have those partnerships within the current healthcare environment, for us to kind of do a handoff to Undo for them to partner with them, that can then jumpstart that process of eliminating that debt.
Okay, well, I'll be getting your card before I leave. Thank you.
Commissioner
Yes.
Baker McCormick?
Thank you, Mr. Chair. So to my colleague Wilson's comment, Commissioner Wilson, I raised that question when we, for those that were in the room, when we approved the funding for this. So do we have the demographics of where these, at least where the bulk of the folks came from? Because they're supposed to provide a written report, because I remember asking that question, how do we know who's getting this relief and what areas because, I'm always about fairness and transparency and how are these monies being appropriated so that some parties don't get it and then others
Right.
do. So what I asked for when we approved it was some type of report saying, okay, we paid this in this area of Wayne County and that area. What's the actual amount? At least we could know that, so we'll know what areas it's coming from. And you don't have a report on yet, or?
We have, we're working with our epidemiology team to build that out in our dashboard.
Okay,
So
great.
that you'll have real-time access to that.
That'll be great.
Whenever we get the update. So we can definitely include it as a part of this report for next, our next cycle.
Because I love the idea, it's just, is it being, fairly implemented?
Right.
It's been about equal from the demographics report that we've
Great.
seen across our county. We've kind of seen, nothing stuck out to us when we initially assessed the raw report.
Okay. And then I also asked during that meeting, were we working with some of the community hospitals right here in Detroit, like DMC?
We're trying.
And, okay,
So DMC is privatized. They're owned by Tenet, which is based in Dallas, Texas.
right.
Which is, Undo has tried multiple times through different states because Tenet owns multiple hospitals, and Tenet has not been a player in this effort. And so, but we're trying as hard as we can. So please believe.
All right, because they were just before us, so we can definitely reach out to them. I'm not sure.
And that's the type of support that we would really
Yes.
appreciate, is any connections. Yeah.
Okay. And then I just love your vision program, and it'll be good to see you guys at my community meeting coming up soon on the 8th. The monitors, you said 10 youth have the actual air quality
The mobile monitors.
mobile monitors.
Mhm.
It's only 10 at this point. I thought it was like more than that.
Our goal is to distribute more, but, we got off to a slower start than anticipated.
Okay.
But we did, and because of that, we expanded the age range, because initially it was it ages 16 to 26 was the eligible age range. And so we have expanded it now. And so now someone that's in their 40s or 50s or 60s that has asthma and they have a rescue inhaler, they're eligible to get a mobile air quality monitor.
Okay. Because my understanding is we've already paid for the monitors and we just have to get them out in the community.
Distribute them. So we're
Okay.
working with Just Air as our partner.
Mhm.
So they've been to multiple health fairs across the county to distribute them. Something that we're revisiting that we're happy to talk about in commission next time we give this report. We know that government trust is low everywhere. And so us passing a device where the government will have your individual data, we've realized that there may be some hesitation there. So we're rethinking the eligibility requirements for who gets that device and whether or not they have to have asthma to be enrolled in our program. So we may kind of pass these out to individuals in a different way than we currently are. So not targeting research more about wildfire smoke. We have this opportunity for a subset to just track your air quality if you're interested, rather than you have to have asthma, COPD, and use a rescue inhaler to receive it.
Yeah, because I would think in Southwest Detroit, they would love to, because they've been trying to look at the evidence of what's going on in the environment in that area. So, yeah. Okay, thank you.
Commissioners? Commissioner Wilson?
Yes. Thank you, Chair Colleen. With the situation in Canada, Michigan has the sixth worst quality of air in not the country, but I think it's the world.
Depending on the day.
So depending on the day. So the monitor is going to help me do what? Categorically, if I'm sick and I have an issue, I ain't going outside in Detroit when I'm the sixth worst quality in the world. So the monitor will help detect, look, don't walk over there across the street
It
because
increases
you might choke to
awareness.
death. I mean, with all this, the quality of air we have here in this state, I mean, how we, just help me out, please. I'm a layman, so for a layman.
Yeah, so air quality rights is a contentious topic that I don't think
Okay.
we'll solve, you know, in this commission, in this
Yeah.
committee meeting,
Six works in a row,
unfortunately.
I'm sure we will.
So
Here.
air quality rights are actually governed at the federal level.
Okay.
They are not governed at the state level. They're not governed at the county level. Eagle is our state kind of partner who has the authority under the federal government to monitor air quality. The purpose and goal of our air quality project, as Director Johnson said, was really to increase the access in everyday residents' pocket, just like you know the weather of the day, for you to know the air quality around you that day. We've seen some great kind of feedback, things and ways that small community groups of you all, as you all have mentioned, have been able to use this data. Right now, there's a lawsuit with Eagle on recognizing that our air quality data can be used for other reports. I attended a conference to talk up more about this, and across the country, we got accolades and other cities and counties and municipalities excited about what we're doing here and taking that as inspiration. Alongside, Just Air is growing very rapidly. So we're just at the beginning to understand what we can do, but it's enabling us to understand more routinely what's going on where across our county, rather than calling Eagle out, waiting 7 days, them doing an air quality test, and that event may be over. The other thing we're kind of working on is with the University of Michigan Law Clinic. They are also analyzing our data, analyzing our air quality network to see what our legal parameters are. We may not have air right, like the right to govern the air from that level, but there are other opportunities that may be in our legal parameters. So we're also hoping to report that out soon too. So it is just the beginning.
Oh, I
It is
appreciate
not
that, 'cause-
it's not a, you know, this is not the.
Not a cure-all.
Yes, it's not,
Yes.
absolutely not, but it's just the beginning, and we're definitely setting the trail here.
So I really appreciate that. If I could just add, as a Romulus City Council member, before I became a commissioner last year, we I think I recall Just Air coming in and doing an air quality test around the airport, because a lot of the residents in the community were complaining of the choking fumes that were being disseminated by the jet fuel from the planes. So I believe that Just Air, they supplied the air monitoring equipment in order to either uplift or diffuse the argument coming from the community. So it was very, very helpful when we got the information back. So I do understand that it's not a cure-all, but it does give us an opportunity to sort of gauge the toxicity, if you will, in the air. And when people have breathing disorders, whether it's asthma or whatever the case may be, then they can understand that it may be in the best interest to stay inside during a certain period of time. So thank you for that, both of you. I appreciate that. Thank you.
Thank you, Commissioner Wilson. Commissioner Baker McCormick?
I just wanted to follow up on what Commissioner Wilson just mentioned, because we brought that up, like, okay, we know that quality of air is bad. But the point that at the time was driven was also that it's about accountability for some of the businesses, like you just talked about the airport, but some of the businesses, we know that the air around them and whatever they're spewing out, we know that it's a problem. And so with the air monitors, it was supposed to kind of tell what level in certain areas. Then we could go to them with the evidence and say, hey, this is what's going on, and it's more for us to work with. So,
Exactly.
yeah.
Thank you.
And with that, when you report back, and I'm talking air quality monitors again, by collecting all this data, what can we do with it in terms of public policy, right? But also with individuals that are carrying the individual
The mobile monitor?
ones with them, has that decreased the number of, emergencies that they've had because they're more aware. But to me, the public policy piece is a difficult one to get at. Because there are going to be some places that are going to vary from day to day, week to week, but then there's going to be other places, maybe an auto plant on the east side of Detroit that's going to be putting this out every day. And so that's a different than, today's Canadian wildfires, tomorrow it's not. But there's going to be these central places. So if you can discuss that the next time you report to us. On this matter of medical debt, that's, and correct me if I'm wrong, you run up the medical debt with your provider, which is overwhelmingly hospital systems.
Right.
And hospital systems carry those debts on their books. Some hospital systems will decide, well, we're going to sell that debt off to a company. And that's who we deal with. Have we had any hospital system say to us, no, we haven't sold it off yet, but we'll work with you?
Yeah,
Are
so,
we working with some hospital systems?
yeah, so there are classified files.
Yep.
And so I cannot confirm or deny
Yeah.
whether a hospital until they agree
HIPAA and all that
to go public. But I can attest that seeing the number of patients that Undo received, because we just get a report that says kind of healthcare partner one with the number of individual records they received, that there is likely a large health system in
Yeah.
the current analysis phase.
But that's why an individual, we can't call you up with an individual.
Yeah, no.
No, this is,
Yeah, we don't even get the
a whole-
hospital, actually. Like, we just see healthcare 1, 2, 3, 4, 5.
right. You just, yeah. And that'll vary. Okay. Any other questions on this item? What's the pleasure of the committee?
Move to receive and file.
Commissioner Marecki moves. Do we have support? And support from Commissioner Anderson. All in favor, please vote on your pads or say out loud, yay or nay.
Motion carried.
What do we have, Madam Clerk?
Pardon?
What do we have for a vote?
We have 3 and Commissioner Rebecca McCormick is not voting. So the motion carries.
Motion carries. Thank you. Next item then, Madam Clerk.
Item 4, requesting commission approval of Amendment 1 to a 3-year comparable source contract with 2 one-year options to renew with Detroit Public Safety Foundation to amend the scope of services and continue providing community-based programming for at-risk youth through the Moving Forward Series program.
All righty, so we're into contracts here. Your name and title for the record, please, sir.
Nathaniel McQueen, Chief Program Officer for Wayne County Juvenile Youth Services, to the chair, to this honorable board.
And the commission approved this about a year ago?
That's correct. This has been approved. It is actually currently in process right now. It is up and operational, servicing the youth within our community. What we have before you today is just simply a amendment of the contract, moving it from a service-based contract to a per diem daily based contract.
Meaning what?
Meaning that as opposed to the services, as services are provided, then the services are the bills are sent into Wayne County and then we pay them. We have a per diem cap per child that gets services. So all of the services would be then wrapped up into one payment per day for that child.
Okay, and there's a long list of subcontractors here.
Yeah, and that's one of the reasons, Commissioner, why we're looking at doing it moving it to a per diem base. It makes it cleaner and easier for our finance department to actually keep track of everything that's being submitted to them, to ensure that we're getting the payments out in a timely manner, as well as receiving all of the invoices in a timely manner. And it keeps everything nice and neat, and it makes their job a lot easier.
So youth get assigned to these subcontractors?
No, the subcontractors are actually a subcontractor of the contract holder that we have, which is the Detroit Public Safety Foundation.
Right.
They are the ones whom we have contracted with to provide these services for our youth. And then these subcontractors come in under them. When they render services, they then submit that invoice for the payment of that service. It could be you rendering a payment today, me rendering one tomorrow. What we've done is we've consolidated all of those services that get rendered to the youth into one per diem.
So the youth are actually, and I might not be using the right word, but assigned to the Public Safety Foundation?
They're assigned to the program. So it's
Yeah.
all, this is part of programming. Yes, the Moving Forward program.
And then within the program, you have these different providers. to,
Absolutely. From mentoring to haircuts to a number of different services that the youth receive.
Yeah. And you have a list of outcomes that we have today in our,
That's correct.
You have
To date,
listed.
we have serviced over 43 youth that have gone through the program, and we anticipate by September the 30th, the first year of the program coming to a conclusion, that we'll have serviced over 70 youth that have successfully navigated the program.
questions from commissioners. Commissioner Peterson Mayberry.
Thank you. So a couple of questions. Are these contractors, have they been vetted?
Yes, ma'am. Each contractor goes through the vetting, so there are federal, state vets that they have to go through in order to work with youth by law.
Okay, because I saw something that said program staffing requirements is either 1 or 2 years minimum of juvenile delinquency experience. So I just wanted to make sure the current subcontractors that we are, if they have a track record, let me tell you where I'm going. So a lot of contractors on paper, and I'm not talking about these contractors per se, but a lot of contractors on paper, you will see one thing, but when you go and see the implementation of the work, it's not to the quality of what we're paying for. Let me just say that. So I just wanted to make sure that with this, and I don't know if these are CBI groups. I'm not sure if these are groups who have been vetted through DPD, because I know they have a very aggressive youth program. If they're a part of that program, some of the names I recognized. So I'm thinking they're a part of that program too, or is this something totally different?
Yes, Commissioner, great question. So one of the things that we do is that obviously we have a contract that is held by a particular group, which is DPSF, and then they subcontract. So one of the things that we're required to do is ensure that DPSF is doing all of their checks and balances when they bring on board a subcontractor. Now, I can tell you personally, after a 32-year career with the Michigan Department of State Police, retiring and then coming over here to the county in 2022, I'm a little bit different. So I always make sure that they've done every one of the checks. We kind of cross-check that, even to the point sometimes getting into a gray area where we really don't have a jurisdiction per se as the county, because the contractor holds the contract and then they subcontract, and we really can't tell them whom to hire or not to hire. So again, 32-year police background, we kind of make sure that we go through and ensure that they're doing all of their due diligence with their crossing T's and dotting I's.
One last one through the chair. I also saw something that said that the ages for this was no younger than 12, but then there was funding mentioned from 7 to 17. So is this group going as low as age 12, or are they going, or is 7 the minimum?
7 would be the bare minimum, but this particular program right here is going from age 12, starting at age 12 for our teenagers.
12 to 17?
Correct.
Okay, thank you.
Questions from commissioners? One more time, if you could just clarify that we're amending, not the dollar amount.
Correct.
What's the amendment to the scope of services?
The amendment is taking it from a per service to a per diem.
Okay. So it's not really the scope of services, it's how we're paying for them.
Correct. It's just combining them all into one category.
Glad to see we have a barber aboard for this too. Well, the kids, as you know, I taught in the public high schools. A lot of these young
Times
people,
we live in, commissioners, the times we live in.
Yeah. A lot of these youngsters, those kind of things, right?
Yes, sir.
You're always seeing these things, how to tie your tie and you know, just some of the basics. So I'm glad to see that's on board. Commissioner Anderson, did you have, yeah?
Just quickly, I did want to, other folks on the committee may have already seen that, but I was pleased to see that 95% of the money that's raised is put directly into the program. for the
Correct.
Kids. Yeah, I thought that was.
Programming is, as all of you are aware, programming is vitally important there within the Juvenile Youth Services Department, our department. That's primarily fundamentally what we're here for, is to make sure that we have programming, not just at our juvenile detention facility, programming for the individuals, the young people who have found themselves on the wrong side of the law, but trying to make sure that they don't find themselves on that side of the law. So.
Questions from committee members? Motions from committee members?
Support.
Moved by Commissioner Anderson, supported by Commissioner Marecki. All in favor? I think it'll pop up on our pads. Get your devices under control.
Motion carried.
All righty. Thank you. Next item, I believe we're on item 5.
Item 5, requesting commission approval of Amendment 2 to a 5-year comparable source contract with 2 one-year options to renew with eClinicalWorks to continue providing software license application hosting services for the electronic medical record system utilized by the federally qualified health centers.
Okay. Just a brief background here after we do name and title. We have a couple of FQHCs, just a real brief background there. And then the EMR, the electronic medical records, which is the basis for the motion for the proposal today.
Sure.
Thank you.
Dr. Avni Sheth, Chief Medical Officer at Wayne County Health, Human and Veteran Services. This is a request for approval for a 1-year contract extension with our EHR vendor, eClinicalWorks. This EHR vendor, eClinicalWorks, provides EHR system for our FQHC, which is called the Wayne County Healthy Communities, located in Wayne and Hamtramck. There are 2 locations, in addition to our public health clinic, which is at the Health Administration building at Wayne. And so they provide EHR and all associated services with the EHR. We are requesting we have a option to renew for 1 year on this contract, which we would like to move forward with. And there is no change to the total award amount. We are just adjusting some account lines to allow for the 1-year extension, according to the clinic program.
So we're calling them EHRs now rather than EMRs.
I think it's personal preference. I think EMR.
I like
is
standardization.
official to EHR.
These
Right.
acronyms. I like, so electronic health record or electronic medical record.
Correct, interchangeable.
And this is how, through this, they can communicate with all of the other health services out there. If somebody that goes to our clinic gets services somewhere else and then they come here, the record follows them.
We are, EHRs in this country aren't yet fully intercompatible, but eClinicals does do a good job of linking with some of our major health system partners. So we are able to see certain data from their visits. Yes. And the main purpose is to have a secure place to document encounters and patient care activities, communicate within the healthcare team, and then obviously refer, order labs, things like that.
Questions from commissioners?
I'll move approval.
It's been moved for approval by Commissioner Marecki, supported by Commissioner Anderson. Any questions before we vote? Seeing none, let's vote.
Motion carried.
Thank you. And thank you. Next item, item 6.
Item 6, requesting commission approval of a 1-year continuation grant award with the U.S. Department of Health and Human Services Health Resources and Services Administration to accept funding to support the continued operations of the Wayne County Healthy Communities, FQHC.
Feel a little bit like Johnny Carson doing Karnak for the final. He holds up the last envelope, our last envelope on our agenda today. If you would introduce a
acceptance
Good af-
request for our 1 year, and I will introduce, I think that's our Executive Director Javar on Zoom there. But this is our continuation grant that we received from HRSA, the U.S. Department of Health Resources and Service Administration, that supports our federally qualified health centers, Wayne County Healthy Communities. It is a grant award of about 2.2 million, which is level funding from prior years. And then I have, I believe on Zoom, our Executive Director of our FQHC, Javar Jackson, also that can provide any background and answer any questions as well.
All righty. Dr. Jackson, would you like to join us?
Good
Hi.
afternoon.
There we go.
Can you hear me? Okay.
It's okay. I think it's a little bit distant, but
Yeah.
No.
Yeah, but the reason they're federally qualified health centers is because the federal government kicks in money each year to provide clinics in underserved areas, which is what we're doing. So it's an annual support that we get through HRSA, right?
correct.
Yeah. Health and questions from commissioners on this? Motions from commissioners on this? Moved by Commissioner Anderson. Did I hear support?
Yep.
Commissioner Marecki. All right, moved and supported. Please vote on your pads. It'll appear on the screen.
Motion carried.
All righty, thank you. Next item, Madam Clerk.
Item 7, revision of resolution number 2025-255, Amendment 5 to a 5-year professional services contract with Southeastern Michigan Health Association.
All righty,
This,
go ahead.
this is just a housekeeping matter, right?
It is,
Move
right,
approval.
yeah, they changed the
Yep.
Yes,
account numbers or what?
correct.
All right, it's been moved by Commissioner Marecki, supported by Commissioner Anderson. Please vote on your screen. Yes, we voted on this a couple months ago, I think.
Motion carried.
That's why I was thinking we were at the end. All righty, next item on the agenda, please, Madam Clerk.
F, such other matters as may be properly submitted before the committee.
We have none. Next item, please.
G, public comments.
All right, we got people who would like to have 2 minutes of public comment. We'll go to anybody that's on Zoom first. Anybody zooming in with us today that would like to have public comment? Any hands raised, Madam Clerk?
There are no hands raised.
Right. Did we receive any emails, Madam Clerk?
No emails were received.
Okay. Anybody in the room that would like to have a couple of minutes of public comment? Hearing none. Is there a next item on the agenda, Madam Clerk?
Adjournment.
Oh, anybody got a motion?
I'll move it.
All right. With no objection,